Steps and procedure to the root canal therapy. So, the tools that you're going to want to have for the root canal are hand files, brooches, endo explorer, endo spreader, a glick, endo plugger, torch, Gates Glidden burrs, paper points, gutta percha, sodium hypochlorite, cavit, RC prep, and sealer. To prepare the treatment, you must review health history, explain procedure, and sign consent form. You must ensure that you have a pre-operative x-ray that is for diagnosing during treatment to determine the file length. After that, you want to apply your local anesthetic to the area and also place the rubber dam. The rubber dam is so nothing falls into the throat, into the mouth. It's a safety thing. So step number 1 is to access preparation. Accessing preparation to the canal, you use an endo explorer. An endo explorer is a very sharp and thin tool. The very sharp and thin tool, it is located at the top where it is very pointy and it helps get into the canal. Step number 2 is you locate the canal and clean and shape the canal. You use a hand file to widen the canal. This will widen up the canal. Those are the canals. And it will also remove the bacteria. The bacteria is right here. This is abscess. What abscess is it is pus. It is an affected pulp. So the hand files could get out any infected pulp tissue. This also right here is barbed brooch. It is a hand file as well, but on the file tip it is fish hooked like, I think, for a stronger grip on the infected pulp tissue. Step number 3, you choose the size of the gutta percha. The gutta percha is a rubber material and it is used to fill the canal. After you fill the canal with gutta percha, you want to take an x-ray to ensure that the sizing is correct. Step number 4, you dry the canals with paper points. Paper points are used to absorb the solution and dry the canal. You don't want to have any moisture left behind in the canal because bacteria may be present. The canal must be completely dry before filling to reduce the risk of infection. 5th step is to fill the canal. What you want to use to fill the canal is a master point gutta percha. You want to use sealer cement, accessory point gutta percha, and an endo spreader. 6th step is you want to burn off the extra points. You will use the torch to burn off any excess points. Number 7, you want to condense the gutta percha. A plugger will be used to compact the gutta percha into the canal. This is a plugger. It usually just pushes the gutta percha straight into the canal. Step number 8, you want to place a temporary filling. This is cement. It is a filling material. It goes right in where it needs to be filled. And the temporary filling is above the canals. And what's in the canals is gutta percha. What's above the filling is the crown. So yeah. Last step, you want to take an x-ray. This is the final x-ray, and this is for, it is used to check the gutta percha filling and to compare it to the new x-ray in the filter to check the healing of the abscess that you have had. After all that, you just want to give the patient a post-operative instruction and dismiss them. They need to avoid eating anything too hard on the side that has gotten work done. The patient is to call ASAP if there is any pain or swelling. Soreness is normal and should subside in a few days. The patient is to return for the final restoration, usually 7 to 10 days after the root canal treatment.